when they have to turn on and, so let's start from the head and tail. So, IV, what's gonna be on that IV pole? What could feasibly status post, meaning after a habit? They can have a ventilator. Some maintenance fluids, because if you're intubated, are you eating? You ain't doing anything besides laying there, like hoping that your hemodynamic is stable. That's the deal. Are you gonna have different drips? Why? And what are some of the drips? Because this is after a habit. This is after your coronary artery bypass. That's one-on-one. Hemodynamic stabilizers. Might you have some pressors? If you're not putting out enough cardiac output, they might press you a little bit. What about insulin? And why insulin? Do they become acidotic? Do you need to drive that K back into the cells? And during times of stress, does the blood sugar go up? So you might have insulin drip. Take care of acidosis, and also if the sugar goes up, you take care of it all in one fell swoop. Is it dangerous to have an insulin drip under like DKA under any regard? The answer is not only yes, but yes, right? So you have to monitor the blood sugar. Yes, you do. So they have ET2 on a ventilator, different settings. Now, who does the ventilator settings? Actually sets them. Respiratory therapy. But are you taught to troubleshoot? Like if it's either the machine or like you might be standing on the tube. You see where I'm going? Or it might be kinked or something, you have to troubleshoot. So is it a patient issue, like they're filling up with fluid, the pressures are going up, or is it a machine problem? So lots of troubleshooting. You have to know that. But RTs are the ones who set the settings, the volume and the pressure and all that stuff. So they have drips, they probably have a beta blocker going, so they have a bunch of different drips up there. Routine kids and some antibiotics, because they just opened up their potatoes. They have that big old battle scar right here, it's usually big. How about down here? Do they have chest tubes? Sometimes it's bilaterally, sometimes it's unilaterally. And then, are they gonna have a Foley catheter? Yeah, we like a, now why do you like a Foley catheter? We know that they're post-surgical. They're not gonna be up, shoot, they can feasibly be extubated and up that afternoon. They move them quickly sometimes, depending on their hemodynamic status. Oh, before I move on to Foley, they're probably gonna have an art line, and that's gonna measure their cardiac output. It's so fabulous, quantified, by the way. Hemodynamic monitoring, they're gonna be able to continuous monitor. And then back down to the chest tubes and then the Foley. Why do you love a Foley in this context? Exactly. So it's one of your best friends in shock to get either a PureWick or a regular, inserted catheter. It's usually a Foley in this case. Big surgery. Oh, and I forgot to say they're using bypass intraoperatively, right? Bypass, ECMO, what was I gonna say? Oh yeah, the Foley. Your Foley, your urinary measurement is a measurement of what? Cardiac output. Would you agree with me? In any regard. So we want, even in a shock situation, you want to measure that urine. Don't forget that. What's a urinary output? What's a BUN? What's a creatinine? Same thing here. So if the heart is not working so well, is their cardiac going to be perfect? Nope. So you need good CO measurement. And then one of the best ways to measure it, not only numerically, but also with are those kidneys getting perfused and are they dumping the fluid? That's how they do it in babies, right? To measure cardiac output when they're under digoxin therapy, digoxin. How do they measure cardiac output in a baby? The diapers, the urinary output, is the best way to do it, to get that Foley. Are they gonna have anti-embolus stockings? Yeah. Either the TED stockings or the sequentials. I describe the sequentials like backwards milking a cow, because that's exactly what it does, but sequentially. squeeze, squeeze, squeeze. And then maybe even flexi pulses. So those are most of the things that they have. And really the recovery is all about hemodynamic stability. Less about infection. It's more about hemodynamic. So I had a Taylor, she was my student at Park Hospital. She got to watch I think it was a cabbage or a valve replacement. And guess what happened that afternoon? She was really excited about it. She got to stay in the OR. She comes up to the court, and then guess what? We hear code. We see the bed with the team. She says, oh no, that was my patient. I said, go. Dress up again, go into the OR, so I want you to watch this process, how they resuscitate that patient. Unfortunately, the patient did not make it. They coded, and they died in front of my student. I said, welcome to nursing. Yeah. And but what I loved about that post-conference was she just bawled. I said, perfect, I love this catharsis. Because sometimes you have to. You might go to the chaplain, you might go to the break room, just bawl your eyes out. The reason she cried is because it reminded her of her younger brother, who, yeah, exactly, who had cardiac issues and congenital stuff his entire life. So that's why particularly it was very hard for her. Now, speaking of who it's gonna be hard for, I'm a very big advocate of doing first touch, taking care of the family. I'm a service-oriented person. And I take care of my patients' families as well as my patient equally. Now, when they're in critical care, what happens? Are you just gonna say, oh yeah, they're in room 202 and sitting there? No way. What I'm gonna do, I know it's a family of Mr. Johnson or whatever. And I'm gonna say, let's just chat a second, okay? This is what you're going to see when you walk in there. You see what I'm saying? It's very shocking. And so we don't want them to, I've seen family just pass out, just fall out right there. Because they see that person and they think they're not ever gonna be okay again, right? So what I do is I say there's gonna be a lot of noises, lots of bells, lots of whistles, and they're gonna be hooked up to this, and that's the monitor to see how their heart's doing. They have some IV fluids and some medications to keep their heart